Welcome. In this video, we'll look at some common spiritual concerns faced by people with serious and life-limiting illnesses. When researchers looked at 24 studies from around the world to learn what's important to quality of life for palliative care patients, they found spiritual concerns played an important role in quality of life in 23 of the 24 studies. Unfortunately, many people don't know that spiritual questions and concerns can cause or worsen suffering. In this course, we'll help prepare you to ease spiritual suffering. First, I want to explain why we focus on spirituality and not religion. Spirituality includes questions about the meaning of a person's life. When a person has a serious or life-limiting illness, spirituality includes questions about what the illness means or represents to that person. Spirituality also includes the relationship a person has with a higher power, a belief system, or a set of core values that guides their decisions and behaviors. We'll talk about this relationship as a person's connection to the sacred. Spirituality is like a global positioning system, or GPS, for the soul or inner self. Our spiritual orienting system helps us make meaning of the world and our place in it. I'll say more about this idea in another module. If spirituality is a global positioning system, then religion is a localized orienting system that connects some people to a set of values, beliefs, and practices that are shared with other people in an organized religious setting. In palliative care, we'll talk about spirituality in the broadest sense, seeking to learn about each person's unique spiritual orienting system that may or may not include connection to a religious group. Now let's look at common spiritual concerns. Although they don't always say it out loud, most patients ask, "Why me?" when they receive a serious diagnosis. The "why me" question can be a major source of spiritual struggle. There are many ways people answer this question for themselves in both helpful and unhelpful ways. Later in this course, you'll learn about 4 common ways people answer the "why me" question and how their approach may affect their illness experience. It can be challenging for people to maintain hope in the face of serious illness. People often have unrealistic hopes for a cure or a return to life as they once knew it. We can help people find hope in achievable goals that reflect the reality of life with a serious illness. People often struggle with their purpose in life when serious illness affects their identity and ability to function and maintain a job. Being connected to nature is an important aspect of spirituality for many people. Losing the ability to spend time, or as much time as they would like, outdoors or surrounded by nature in some way can have a significant effect on well-being. Being able to continue spiritual practices like prayer, meditation, and worship can be challenging with limited mobility and energy. People feel stressed when they feel like they're not being faithful to their belief system. In a study in Switzerland with palliative care patients near the end of life, researchers affirm that spiritual well-being is a strong predictor of quality of life. It's important that we don't neglect this often forgotten aspect of the patient and family. In upcoming lessons, we'll look at a few types of psychosocial spiritual concerns in more depth.